Hi, I'm here to talk to UGA students today about Ambien and Ambien addiction. Ambien is the name of a prescription medication sold in the United States. The name of the drug inside the medication is zolpidem, and this medication is known as a sedative hypnotic, which means that this medication is used to treat sleep disorders, most commonly used to treat insomnia. Ambien should only be used under the supervision of a healthcare professional, such as a primary care physician or a family doctor. Ambien is only intended for the short-term relief of insomnia and should not be used for more than 35 days. This is due to tolerance and dependence that can set in as early as 2 weeks. If improvement is not seen within 7 to 10 days, you should contact your primary healthcare provider and choose another option. A typical dose of this medication is 10 milligrams taken every night at bedtime. The intended effect of Ambien is to cause sedation and induce sleep, although a number of other effects can be seen while on this. The number one side effect is tolerance. So after a certain period of time, whoever is taking this medication might find that it is no longer helping them. A lot of other side effects are similar to alcohol and include sedation, loss of motor control, and memory impairment. Some other side effects include euphoria, hallucinations, and sleepwalking. All of these side effects combine to cause a high degree of abuse potential in this medication, as a lot of people will recreationally take it in order to get some of these effects. Sleepwalking in particular can be a dangerous side effect, as there is a number of reported cases of individuals walking into traffic or getting into car accidents or hurting themselves while sleepwalking. Due to the previously listed effects, a lot of people will take Ambien recreationally and abuse this medication. Uh, some of the effects of abuse that can be seen are increased incidence and severity of the previously listed effects, and this can be particularly seen in dependence, blackouts, and amnesia. This can be particularly harmful to students who feel sleepy during classes or have a hard time remembering content that was studied for previously. There is a risk of overdose on Ambien, although a lot of time overdose occurs in combination with other depressants such as alcohol. A common scenario is drinking a lot of alcohol during the night and then taking multiple tablets in order to have a good night's sleep to sleep off any hangover that might be coming, and that can lead to a serious risk of overdose. While on Ambien, it is important to remember that this is an addictive medication and addiction can set in as early as 2 weeks. A lot of times prescribers will write this medication for 30 days as the maximum recommended length of treatment is 35 days, and this is greater than that 2 week threshold, which increases the risk of addiction. A lot of times addiction will start out as treatment for a short-term episode of insomnia and can lead to long-term use of this medication. Some risk factors for Ambien addiction include taking higher doses than prescribed or taking this medication without a prescription. There are some common signs of Ambien abuse and Ambien addiction, with the most prominent one being the inability to fall asleep without taking this medication. Some other signs of abuse include cravings, irritability, social withdrawal, memory loss, and withdrawal symptoms. Students who take this medication will have particular issues with anger as well as maintaining social relationships. Memory impairment can be particularly impactful on students who need to study and prepare for tests, and grades may suffer while abusing this medication. If an individual stops taking this medication, all the signs of abuse will be present to varying degrees. There are a number of groups of individuals who are at particular risk for Ambien abuse and Ambien addiction due to the high number of prescriptions written for these individuals. Due to the natural aging process, elderly patients may find it hard to fall asleep and will be written Ambien commonly to help aid in sleep. A lot of times workers who work the night shift and have to sleep during the day will get an Ambien prescription to help them sleep during the day, and long-term use of Ambien can lead to Ambien addiction and Ambien abuse. Pregnancy also has a risk of insomnia, and pregnant mothers may receive Ambien to help them sleep. Students are also a risk group, as students are typically stressed out, especially during final periods and during normal course load work. Students may find all the stress leads to difficulties in sleeping and may often be prescribed Ambien prescriptions. So it's really important to remember if you see any of those signs of abuse or you're seeing any of those adverse effects, there's nothing wrong with recognizing there's a problem and reaching out for the help that you really need. You can always talk to your doctor, you can always talk to your pharmacist, or if you don't want to talk to someone face to face, there's also a number of hotlines available. Drugabuse.com has a great hotline, and if an overdose is suspected, then Poison Control really has individuals that are trained to help with those situations. So the takeaway message is only use this medication when prescribed. Only use it for short-term use because this is not intended as a long-term treatment for insomnia. And really try and treat the underlying cause, which includes managing stress, using time management skills to keep the coursework under check, and really try and treat the root cause. So try improving sleep hygiene, which means sleep in a dark room, really get a consistent sleep schedule, try and sleep for 8 hours a night, and really try and turn off screens an hour before going to bed. So thank you very much. These are our references. Enjoy the rest of your day.